Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with infectious disease specialist Dr. John Brooks, and we're talking about wounds that will not heal. Dr. Brooks, why does McLaren Port Huron have a dedicated unit that specializes in wounds that won't heal?
So we're going to go back in history to 15 years ago. We realized at that point in time that we are a community that has a lot of people with diabetes, and that when they have a diabetic wound or a wound that isn't healing, that we just were not giving them the best possible care. So a group of physicians, myself included, we had vascular surgeon, cardiovascular surgeon, general surgery, family practice physicians got together and worked with the hospital, and then we partnered with a company that is now called Healogics to bring in a technology leading wound center here to Port Huron, so that in our community, patients will be able to receive top level care and not have to leave our town.
Do you have healing goals at the Wound Healing Center?
Absolutely. So there are internal goals and there's external goals. So we have what we want to do, and we want to heal everybody, and that may be a little unrealistic, but when we look at our 15-year record, we're about 99% healing of our patients over the years.
That's amazing.
Yeah, it is pretty amazing. Now, there are some patients that walk in our door that from day one we know we're not going to heal them. So there are some factors that go into play with that. So in our statistics, we don't count them, so we know that they're not part of it. But in general, patients that come in that have diabetes or some other medical problem that have a wound, we have a very good chance of healing their wounds.
So how does the Wound Healing Center and all the staff and everybody that works there, how do they help heal wounds?
So what happens is that patients first get a good assessment. So when they come to us for their first visit, they're going to get a complete assessment. We have a highly trained nursing staff who will do what's called an intake. They're going to go through and ask the patient lots of questions. We also have an intake form that we've had a chance to review beforehand. We look at their medications and of course their medical problems and their surgical history, as what's gone on with their life that made them come to our wound center. So then the doc comes in and the nurse practitioner, and then our job is, by our training, we have gone to a special training course. We've had extensive training on wounds, and we've also got extensive training on hyperbaric oxygen therapy, which is one of our treatments. So we are trained to know what to do with these wounds, how to assess them and come up with a treatment plan, will then allow these patients to go down a pathway to heal where they weren't healing before.
That has to feel really hopeful to people.
Oh, absolutely. And it's one of the things that patients will come in, especially if they've been 2 or 3 months with the wound, which is not unusual for us. And they'll come in and look and say, nobody else has healed this. We say, hold on, give us a chance. And 3, 4, 6 weeks later, when they're healed, they're absolutely amazed, like, how come nobody else could heal me? And we look and say, well, you got to understand, you've come to a specialized center where we've had specialized training, and we know what to do with all the technology that exists.
Well, we're going to kind of break down the treatments later, but I wonder if you can just give me a list of the treatments that you have available.
So one of the things that we do that when somebody comes to the wound center is, one of the things that's common we do is called debridement. So we take the wound and we clean the wound, and we do that with surgical instruments. So we numb the wound up, and then we will surgically debride the wound because that stimulates it to help it heal. Mm-hmm. Then we have a whole cadre, a whole bunch of different wound products that we use that are, some of them are very natural, that are based on seaweed, some are based on collagen, which is a natural molecule of our skin healing. We have stimulators that help the body heal. We have hyperbaric oxygen therapy, which is our top-end technology. That is a chamber that the patient is put into. They're exposed to 100% oxygen under pressure, and that creates an environment that you cannot find on the planet Earth. Mm-hmm. So in that environment, the body will grow new blood vessels, which then heals tissue that couldn't heal before.
How do you decide what the patient needs?
So it has to do with how they were wounded. How do they have their wound? Somebody that comes in with a diabetic foot wound will look and say, okay, so we know you have diabetes and you have a wound or an ulcer. So we know we've got to clean it up, and we're going to try to heal it up. Now, how deep the ulcer is and how much involvement there is of the ulcer of the wound, that's going to then tell us what do we do next. Very, very deep wounds that go down to bony structures need a lot more therapy and intervention than a wound that doesn't go so deep.
Are there protocols or things that you follow, or is each patient absolutely individual, or is it both?
So the good news is it's individualized care for every patient, but absolutely there are scientifically proven protocols of what pathway you can walk down. We call them a pathway. So somebody comes in with a diabetic wound. Now here are going to be the 13 tests that we're going to do to assess their vascular supply, their nutritional status. Do they have an infection or not? Do they have a bone infection? We do cultures, are there deep infections within the patient? So we do this assessment, we put the information together, and then we come up with a pathway. How are we going to heal them?
It sounds like it takes a certain amount of commitment from the patient too, because it sounds like more than one visit.
Yeah, so it's a weekly visit. That is our usual pathway. Well, they'll come and see us on a weekly basis. And there's actually science behind that, because when we debride a wound, the week cycle gives it the best amount of ability to heal.
Wow, this is great information. We are going to stop and take a little break and then continue our discussion.